Okay, so let's dive into this world where like ambition and innovation, they collide head on with some serious ethical questions.
Yeah.
You know what I mean? And you sent us a bunch of stuff about Neuralink, Elon Musk's brain-computer interface company.
Right.
And you want to know if it's really revolutionary or just a lot of hype.
Well, what's captivating here is this intersection of like cutting edge science with the immense influence of somebody like Elon Musk.
Yeah.
You know, like, is he a visionary pushing boundaries, or is Neuralink a reckless experiment fueled by ambition and maybe even ego?
Yeah. And it's like every time I turn around, there's another headline about Neuralink, some touting incredible breakthroughs, others raising serious ethical red flags.
Absolutely.
So let's just break it all down.
Yeah, let's do it.
What exactly is Neuralink and what are they trying to achieve?
So at its core, Neuralink is developing a brain-computer interface, a device that can connect directly to the human brain, and they aim to help people with paralysis and neurological disorders like quadriplegia and ALS. So imagine a world where someone with limited mobility can control a computer, a prosthetic limb, or even their own limbs simply with their thoughts.
That sounds like something straight out of science fiction. How does it actually work? I mean, are we talking about like plugging a USB into your brain?
Not quite. Think of it more like a tiny, intricate network of incredibly thin threads, thinner than a human hair, that are implanted into the brain.
Okay.
And these threads are packed with electrodes, which are like miniature sensors that can detect the electrical signals produced by brain cells.
So they're basically eavesdropping on the electrical chatter in your brain. That's wild.
It is wild. And they can do more than just listen. These electrodes can also send out their own electrical signals to stimulate specific brain areas.
Oh, wow.
So it's like a two-way communication system between the brain and a computer. And they've even developed a surgical robot, the R1, specifically designed to perform these delicate implantations.
Okay, so the tech itself is definitely mind-blowing. But yeah, a lot of your sources, and I have to say I'm a bit disturbed by some of them, they point to some pretty serious concerns about Neuralink's animal testing practices.
Yeah, that's where things get ethically murky. There have been reports of numerous animal deaths during Neuralink's experiments, potentially over 1,500 animals, including monkeys, pigs, and sheep, since 2018.
Wow, that number's just staggering.
It is.
It makes you question whether the potential benefits outweigh the cost in terms of animal suffering.
Yeah,
What's even more concerning are the allegations of rushed and botched surgeries,
right.
leading to unnecessary pain and even death.
And it's not just animal welfare groups raising concerns. The FDA itself has cited Neuralink for objectionable conditions at their animal testing facilities. And one particularly heartbreaking case highlighted in your sources involves Animal 13, a monkey who experienced severe complications after receiving a Neuralink implant and was ultimately euthanized.
Yeah, that's the case that really stuck with you. It makes you think about, the individual animals behind these statistics.
Right.
And the immense responsibility researchers have to minimize suffering. All of this makes it even harder to comprehend how Neuralink receives FDA approval for human trials in 2023.
Well, it's important to remember that the FDA evaluates clinical trials based on a balance of potential benefits and risks. They clearly saw enough promise in Neuralink's technology to justify moving forward with human testing, but it doesn't erase the ethical questions surrounding their animal research.
And which brings us to Noland Arbaugh, the first person to receive a Neuralink implant in January of this year.
Right.
Initially, it seemed like a huge success.
Yeah.
He was able to control a computer mouse with his thoughts.
Yeah.
A remarkable feat.
But then, weeks later, Arbaugh reported that a significant portion of the implant wires had detached from his brain, and he started experiencing complications.
Oh, wow.
And it raises serious concerns about the long-term stability and safety of the device.
Yeah, it really highlights the inherent risks associated with brain surgery and implantation.
Absolutely.
Brain swelling, infection, potential long-term effects on cognitive function.
Yeah.
I mean, we're talking about tinkering with the most complex organ in the human body.
Exactly, and it brings us back to the question of Elon Musk and his motivations. Is he pushing this technology too fast, driven by his ambition to be at the forefront of innovation, even if it means cutting corners?
He's made some incredibly bold claims about Neuralink, some of which haven't quite panned out, like when he said Neuralink would have humans walking again by a certain date.
Right.
Right.
And remember those statements he made about Neuralink's potential to solve autism and schizophrenia? Those claims drew a lot of criticism from scientists and the autism community.
Yeah, it does seem like he tends to overpromise and underdeliver. Is it a genuine belief in this technology, or is it a calculated strategy to attract investors and distract from the ethical concerns?
It's a question we need to consider, especially as this technology continues to develop, and that leads us to another crucial point. Neuralink isn't the only player in the brain-computer interface game. There are other initiatives out there taking different approaches.
Okay, so maybe there's a way to reap the potential benefits of this technology without the ethical baggage. Tell me more about these other initiatives.
One example that stands out is the Walk Again project, and it's a collaborative international research effort focused on helping paralyzed patients regain movement using brain-computer interfaces.
Okay.
And they've achieved some pretty remarkable results with paralyzed individuals controlling robotic exoskeletons and even regaining some voluntary muscle control.
Wow, that's incredible. What's different about their approach?
Well, a key difference is their emphasis on ethical considerations and responsible scientific practices.
Okay.
So they're very transparent about the research, they engage with the broader scientific community, and they prioritize patient well-being, and it's a stark contrast to Neuralink's more aggressive, often secretive approach.
Yeah, it almost feels like two different philosophies clashing.
Right.
One driven by a move fast and break things mentality,
Yeah.
the other by a more cautious and collaborative approach.
And that's a tension we're likely to see more of as this technology evolves. On the one hand, you have the allure of rapid innovation, pushing boundaries, achieving seemingly impossible feats. But on the other hand, you have the responsibility to consider the potential risks, the ethical implications, and the broader societal impact.
Right. It makes you wonder, are these rapid advancements actually beneficial if they come at the cost of ethical principles and potentially put people at risk?
It's a valid concern, and it's not just about the physical risks.
Right.
Think about the societal implications. If Neuralink's technology becomes widely available, who will have access to it? Could it exacerbate existing inequalities, creating a society where enhanced have a significant advantage over those who don't?
Right. It's like that old saying, just because we can do something doesn't mean we should. And it's not just about access.
Right.
What about the data collected by these devices? Who owns it? How is it used? Could it be used to manipulate or control people?
That's a huge concern. Imagine a world where your thoughts, your emotions, your very consciousness could be accessed and exploited.
Yeah.
I mean, we need robust regulations and safeguards in place to protect people's privacy and autonomy in a world where their brain activity is no longer entirely private.
It's almost like we're on the cusp of a new era, one where the line between human and machine becomes increasingly blurred.
Absolutely.
And with that comes a whole host of ethical and philosophical questions that we as a society haven't even begun to fully grapple with.
We're essentially entering uncharted territory,
Yeah.
and we need to proceed with both caution and a willingness to engage in these difficult conversations.
Now, shifting gears a bit, you sent in some truly thought-provoking questions,
Okay.
and I think they get right at the heart of what we've been discussing today.
Yeah.
The first one is about Elon Musk's claim that Neuralink could treat conditions like autism and schizophrenia. Is there any scientific basis for these claims?
So that's where it's crucial to separate hype from scientific reality. While brain-computer interfaces hold promise for treating certain neurological conditions, Musk's statements about autism and schizophrenia are not supported by current scientific evidence.
I get the feeling he's overstepping the boundaries of what's scientifically plausible, maybe even exploiting the hopes of vulnerable people to promote his agenda.
Conditions like autism and schizophrenia are incredibly complex, and there's no quick fix.
Right.
Reducing them to something that can simply be solved with a brain implant is not only misleading, it can be deeply stigmatizing.
Absolutely. It's crucial to approach these claims with a healthy dose of skepticism and rely on evidence-based information from credible sources.
And this ties into another question you asked about the potential societal implications. You're right to be concerned about who will benefit from this technology and whether it will worsen existing inequalities.
Right. Could we see a new kind of digital divide where those who can afford neural implants have enhanced cognitive abilities, leaving others behind?
It's a very real possibility. Imagine a future where access to education, employment, even social status is determined by whether or not you have a Neuralink implant. It could create a society where the enhanced have a significant advantage over those who don't.
It's a sobering thought.
Ah.
Okay, one last question before we wrap up. This one is about alternatives to Neuralink. Are there other less invasive brain-computer interface technologies on the horizon.
Yeah, there's a lot of fascinating research happening in this field,
Okay.
exploring non-invasive methods like EEG or electroencephalography.
EEG, that rings a bell. Refresh my memory. How does that work?
So instead of implanting electrodes directly into the brain,
Right.
EEG uses sensors placed on the scalp to measure brain activity.
So it's like listening in on the brain's electrical signals from the outside.
Exactly. While EEG doesn't offer the same level of precision as Neuralink's implanted device, it's much less risky and could still have incredible applications.
Like what? What could you do with that?
Well, for starters, it's already being used to help people with severe paralysis communicate. Imagine being able to control a computer or even a prosthetic limb just by thinking.
That's amazing. It seems like there's a lot of potential for developing brain-computer interfaces that are both effective and ethically sound.
Right.
You know, we can innovate without sacrificing our principles.
Absolutely. And I think it's essential to support and encourage this kind of research, especially as Neuralink continues to raise these very serious ethical concerns.
So we've covered a lot of ground in this deep dive into Neuralink. We've explored the technology, the controversies, the potential benefits, and the very real risks. It's a complex and rapidly evolving field, and frankly, it's a little unsettling to think about what the future holds.
It's true. This technology has the potential to transform our lives in profound ways, both for better and for worse.
And that's what makes these conversations so crucial. We need to be informed, engaged, and willing to ask the tough questions.
Exactly. We need to be critical consumers of information, especially when it comes to something as groundbreaking and potentially disruptive as brain-computer interfaces.
So what's the takeaway for our listener today? What should they be thinking about as they process all this information about Neuralink and the future of brain-computer interfaces?
Well, I think the key is informed skepticism. Don't just accept everything you hear, especially when it comes from someone like Elon Musk, who's known for his grand pronouncements. Dig deeper, research different perspective, and form your own conclusions.
That's great advice. And to add to that, I think it's also important to remember that we're not just passive observers in this technological revolution.
Right.
We have a responsibility to shape the future we want to see.
Absolutely. By engaging in these conversations, educating ourselves, and demanding transparency and accountability from companies like Neuralink, we can help ensure that these technologies are developed and used responsibly and ethically.
Well said. It's been an eye-opening conversation, and I think we've only just scratched the surface of what's to come. Who knows what the future holds for Neuralink and other brain-computer interface technologies?
It's definitely going to be a wild ride, but as long as we're informed and engaged, we can help navigate the ethical challenges and harness the potential of these technologies for the betterment of humanity.
I like that, informed and engaged. That's something we can all strive for. Thanks for joining us on this deep dive into the fascinating and often troubling world of Neuralink. We'll be back next week with another deep dive into a different topic, so stay tuned.